sobering in some ways, but celebratory too. That's nice. You've been a card-carrying PhD for a little while, I guess, huh?
Yeah, since March of last year. So it ends the year of celebration of my PhD.
There you go. Nice. Congratulations.
Thank you. Well, I have 1:15 straight up, so we will go ahead and get going. I'm Chuck Carney, Director of Media Relations for Indiana University, and welcome again to our weekly assessment of everything going on with COVID-19 with the City of Bloomington, Monroe County, Indiana University, and Indiana University Health. We will start off with opening comments, and this week we'll start with the county in Penny Caudill, as it's been a very eventful week as far as regulations go.
It has been an eventful week, Chuck. Thank you. And thanks for kind of letting me go first to talk about the buzz around the latest CDC guidance for fully vaccinated people. And I'm going to try to share my screen if I can. Maybe not. Your screen. Okay, there we go. Hey, technology, I'm learning. So the CDC announced yesterday that those who are fully vaccinated do not need to wear a mask or physically distance except where required by federal, state, local rules, regulations, including local businesses or workplace guidance. Now, there are some exceptions. And that could be if somebody is immunocompromised, then they certainly should still wear a face covering or a mask. There are going to be places where they are still required or recommended. But if you go down this list, you will see that if you were fully vaccinated, you get to do so much, and you can do these things safely, in a much more safe manner than if you were unvaccinated, where you still need that mask or face covering. So we encourage people, I hope that this guidance encourages people that may not have been vaccinated yet to go ahead and do that. We have lots of opportunities in this community to be vaccinated. I want to talk a little bit about what it doesn't mean. It doesn't mean that if you are fully vaccinated that you can't wear your mask. And I know that there are many people who are fully vaccinated who will continue to mask up in many situations just for their own comfort level. And that is perfectly okay. There are instances where that may be required even if you are vaccinated. So we want to be respectful of everyone and their decision, even if they're fully vaccinated, to still need that extra comfort of that mask. If you are unvaccinated, then masks and distancing remain a vital precaution to ensure your health and the health of those around you. Those eligible for vaccine now are 12 years old and up. So we still have many who are not able to be vaccinated. So let's continue to protect them. You can do that by wearing your mask, distancing, and then being vaccinated so that you don't have to wear that mask. So again, please mask up until you are vaccinated. And if you want to continue to mask up after that, you may do that as well. So where are we now? While Monroe County is in a yellow advisory, the good news is that cases per 100,000 dropped to 63 per 100,000 this week, and they continue to decrease. Our 2-metric score this week is 0.5 or blue, yet we remain in yellow because we have to be at that level for 2 weeks in a row. And we are on target to get there. At this point, we should be in a blue advisory next week. The recommendation of the health officer during the last Board of Health meeting was to remove local orders when we were in a blue advisory, and other data aligned with that. We are just about there, excuse me, and factoring in the latest CDC guidance, the health officer is rescinding the current health order effective Monday, May 17th at 8 a.m. So what's that mean? It means that there will still be some requirements to wear masks and or to distance, vaccinated or not. And a few of those examples are federal or state property, in vaccination clinics, in COVID testing sites. Other government offices may still require distancing or masking. Local businesses may continue these requirements as well. That is their option. Please be respectful and accommodating of those requests. This change is effective on Monday, and while that is not long, it is intended to give businesses a little time to decide how they want to proceed. Our current health order and regulation was set to expire at the end of this month, so we do believe that people were already preparing for that possibility. We hope giving them a few days to kind of put that plan into action will be appreciated. Many people will continue to wear masks even though they're vaccinated, and that's fine. And there are certainly reasons to do that, as I mentioned earlier. So talking about vaccines, with more vaccine available, our focus at the health department has been shifting forward into reaching more people and to reach a high level of vaccination in this community. Yesterday, when we were looking at our vaccine data, over 44% of those who were 16 and over were fully vaccinated in our community, and over 50% have received the first dose. Today, we now have that 12 plus age group added into there. So we now, instead of 128,000 eligible people, we have 133,000 eligible people. And so fully vaccinated as of today, we have 42.7% fully vaccinated, and 48.6% have received their first dose of vaccine. So we are pleased, and we want that to continue. Yesterday, with the Pfizer being eligible for 12 and 15-year-olds, we saw a big increase in people seeking that vaccine, and that's very promising. We're very pleased about the interest in that. We are working with schools to have some special school clinics, but keep in mind that the site at IU is ready to go for anybody who is eligible, and we encourage you to do that. Some outreach that we have coming, and I'll have more details on these as we go forward. We are planning a clinic at Ivy Tech for early June. That should be posted on the rshot.gov in the next few days. And we have plans for some other outreaches, farmers market in Smithville and various other places, some even maybe pop-up clinics, so they'll kind of be a surprise. So that is where we are going to be putting our focus, is extra focus on messaging about vaccine. And we really, really, really want you to consider getting that vaccine. Rescinding this order does not mean that masks are not important. They are. If you have not been vaccinated, you still need to continue to wear your mask, to socially distance, to maintain that physical distancing. All those things that we've been talking about are absolutely vital if you are unvaccinated. And if you are vaccinated, there are still going to be times that you will need to wear that mask, just because it is a requirement of a business or a location. So lastly, with that, I would say please remain respectful of one another, wear your mask when it's needed and required, and get your vaccination as soon as you can. Thanks, Chuck.
Okay. All right. Let's next go to Mayor Hamilton for comments.
Thanks very much, Dr. Carney. We're glad to have you back, and glad to be with you all. Thank you, Administrator Caudle, for that. It's a big week with the new CDC guidelines and the county, as indicated. You know, of course, I may just add, from the national level, the messaging was basically based on three things. One, infections in the United States were down significantly, a third or more over the last just short weeks, in infections decreasing, vaccination percentages going up, so that's good. And also evidence that the vaccines really, really work very well in terms of protecting people from any symptoms, and certainly from any serious symptoms. They're very, very effective. So it is a momentous day and thing to mark that we have come a long way. It is smart in my view, and it's very welcome to indicate that those who are vaccinated should realize benefits of that choice and getting that done. It's also really, as Administrator Cottle mentioned, it's based on the fact that masks have worked in the country and in our community, and that vaccinations are working. I will say it's challenging too. We as we look at the changes, it's actually the case that most people should still be wearing masks. Most people are not fully vaccinated, as we know, both locally and in the United States. So the celebration, if you will, the realization that the masks have worked and vaccines really work and are working, we actually should see most people continuing to wear masks, because most people are not fully vaccinated. And as Administrator Cottle also mentioned, it's no stigma at all. It's good to wear a mask. Many people may choose to wear a mask even after vaccinated, but those who are not vaccinated really should continue to wear a mask. We're going to continue to review policies as an employer for the city, for example, and others. I wish we had a few more days to do that, but we will move as expeditiously as we can. And I think it's worth noting that this is really a statement of faith in people making good choices. We've depended on people making good choices for well over a year in protecting each other, and we've seen extraordinary good choices by so many people and voluntary efforts, and we're asking for that to continue as people both protect themselves, but also, if not vaccinated, continue to protect others. So we'll be looking at that at the local level too. I will just note, I was looking at the data, I couldn't help but note that, in Indiana, we average about 2 deaths a day from traffic accidents, traffic fatalities, average around 2 people per day in the state. We are now losing about 7 people per day to COVID still in Indiana. So it's really important, I think, to recognize this is a big deal. We're still in the middle of very challenging times, and I completely support welcoming and endorsing the changes that those of us who are fully vaccinated should recognize. But I think it's really important to recognize we're really still not out of the woods, and there is some risk that we could see something turn the wrong direction. We sure hope not. But we don't drop the speed limits when a few people are doing the right thing. A lot of people. So I want to encourage us to remember we're not out of the woods yet, and still need to see a lot of good behaviors going forward. We'll hope for that. Just the quick updates I usually give. We actually have now ticked over 50% of city employees who are eligible who have now applied for the wellness benefit for vaccination. So we're pleased with that, though we will be adding several hundred seasonal workers that may change that. We'll see how that goes. And we had 1 new case in the city last week, and that was all managed as our usual protocols. But it is a really important day, and I hope we'll be able to manage through this in the coming weeks. And it's certainly something to mark on our calendars as a long achieved and long sought goal to be able to move forward this way. Thanks. Back to you.
All right. So next, check in with the Monroe County Board of Commissioners and Julie Thomas.
Good afternoon, Dr. Carney and everyone present. Thanks for being here. And it is a really good day. And this is a positive day. And I think we should embrace what we have and what we've achieved as a community. We still have more people to get vaccinated, and hopefully that will happen sooner rather than later. So I do want to give a shout out to everyone who has been vaccinated. You helped us get here in terms of our color code status, hopefully going into blue. And it is a great time to remind everyone to wear a mask wherever you feel you need to, and to be kind to others who choose to wear a mask. Don't make assumptions, and please be respectful, as Ms. Caudle says. Just a reminder to those who are still dealing with the consequences of the economic downturn due to COVID-19. Every resident of Monroe County lives in a township, whether you live in the city, a town, or not. And if you are struggling to pay your bills, things like rent, utilities, please reach out to your township trustee as soon as possible. The Monroe County Board of Commissioners and Monroe County Council work together to provide funding, a township assistance fund, to provide direct funding to residents who are in economic need. To date, we have provided over $80,000 to 148 households in our community, keeping people housed and their utilities on, and we're really proud of that effort. We will be given the news from the CDC and the change in the health order, a note for our wonderful employees who have been magnificent throughout this whole adventure over the last year. And again, thank you for all of that work. We will be sending out a message later today to our employees on email regarding Monday's workday. And also we'll send something out on Everbridge. For those of you in the community who need updates on things like pop-up clinics for vaccines and times that are available for appointments for vaccines and things like that, please sign up for Everbridge. Everbridge is our ability to communicate with everyone in the county, but it only works if you're signed up. Just go to co.monroe.in.us and click on the megaphone in the center of the screen, and you could sign up to receive text message, email, or phone call. And this goes for weather emergencies, other emergencies, but we're also posting health information on this source regularly. So we're really excited. We encourage those who have not yet been vaccinated, please get vaccinated as soon as possible so you can enjoy the fruits of this labor, and to encourage your friends and neighbors to get vaccinated if they haven't done so yet, and see if you can direct them to appropriate sources for information if they have questions. With that, we'll take questions. Thank you.
Okay, let's next go to Monroe County Emergency Management Director, Allison Moore.
Good afternoon. Thanks, Dr. Carney, and thanks again for hosting us every week. We greatly appreciate it, and all of our media for being on this call week after week. We continue to look back and to look forward, and we have come so far, and we still have a little ways to go. So we encourage all those that aren't vaccinated to continue to wear those masks and make those appointments if you haven't, and get your vaccination shots. And join us in continuing to move in a positive direction. We do have blood drives scheduled. We've got those blood drives now scheduled out through July. They're all on our county website, the ones that we host at the Monroe County Convention Center. The city also hosts one at the City Hall building every Wednesday. And so I encourage you to check out our website, see the dates that could work for you, and then swap over to the redcross.org website and make an appointment to continue on making our blood drives successful this year. We're still leading, one of those leading the packs in Indiana on the amount of blood that we're collecting. And so it's exciting that we are coming together in trying times during this pandemic and making a difference. And I appreciate all those that have supported or that can support by making that blood donation. Another thing I wanted to mention, Commissioner Thomas mentioned the Monroe County alerts. And we have gotten several calls from individuals that maybe received a message a certain way and would like to switch to receive it more than one option. So you can receive your messages by text message, by phone call, or by email, or all three. And so since we are sending out such a pop-up clinics and and health alerts and such. There are many people that wanted this information more readily available, and maybe they didn't get it as a text message. And so I just wanted to let the public know that's something that can be changed or added at any time. And when you created your account, you should have a user and a password that can get you in to make such changes. But if for some reason you're having challenging, or you're like me and you might have forgotten a password that you set yesterday, you can give our office a call at 812-349-2546. or hop over to our county website and get our information as well. That information and phone number and email is there. Or shoot us an email, and we'll be happy to get back with you and help assist you to make sure you're getting the alerts how you wish to receive them. And that's all I have, Chuck. Thanks so much.
Okay, let's next go to IU Health and Brian Shockney.
Thank you, Dr. Carney, and thank you everyone for joining us each week. This is the culmination of our Healthcare Heroes Week. So if you've not done so on this Friday, send an email to your favorite healthcare hero or give them a good socially distanced pat on the back for their, with a mask, for their work that they have done over this past year, and to celebrate them. Over the past week, our number of COVID inpatients have remained above the double digits, so above 10 every day in the region. You can see a slight increase as we've seen the increase in our Lawrence County area. Here in Monroe County, IU Health Bloomington and Monroe Hospital, we have seen a little bit of an increase as well, but really staying above that that 10 mark, not really dipping below, which is a good steady rate right now. So we're feeling comfortable there. As of yesterday, we have vaccinated 84,674 individuals at our Bloomington and Paoli sites. This week, we will administer our last first dose. Let me say that again, our last first dose at the IU Health Bloomington Vaccine Clinic at the Medical Arts Building. Over the coming weeks, we're going to change our focus and have been changing our attention to operationalizing vaccines at our clinics, at our outpatient sites, for all the locations that we have, so that every time a patient comes to us, we can ask them, have you been vaccinated? Just as we do with flu and other vaccines. And we'll have those available at all of our sites where we can then, urgent cares, others, where we can provide those vaccines and get those shots in arms. IU is taking over that shot clinic as far as the walk-ins and those kind of things, and just continues to do a great job and continues to have capacity for vaccines. Our vaccine supply at Bloomington continues to be in good shape. We've utilized 63,186 of the 63,720 vaccines for a 99% utilization percentage. We want to thank everyone who is keeping their appointments. Last week I asked, please keep your appointment even though walk-ins are available. We have had, with our walk-ins, and since the 12 to 15-year-olds information was released, we've had at least 50 of those 12 to 15-year-olds daily walk into our clinics and get their shots. So thank you, moms and dads. Thank you, students, for doing the right thing. We can learn a lot from this generation that is going to tell the stories of living through this pandemic. As Administrator Penny Caudill stated, the CDC has provided us with recent updates to mask wearing in different settings, but I want us to note that the guidelines for hospitals and healthcare settings still remains the same, with mask wearing and other best practices in place. Even though those restrictions have relaxed on the outside within the healthcare facilities and all of our business units, everywhere that you experience IU Health, those same requirements are still in place. The Badge of Honor campaign, we shared a sneak peek of it last week, and everyone was able to raise their sleeve and show our hearts for getting that vaccine. And we are so excited that our community members are showing their support as well. Hopefully you've seen those commercials and PSAs of our celebrities here in Indiana who are getting their shot. And please know that even if your Band-Aid isn't a heart, it's still a badge of honor in this fight, and we are very thankful for everyone who has done their part so that we can begin to get back to normal. I will take questions at the end.
Okay, let's next go to Indiana University and check in with Kirk White.
Well, good afternoon, everybody. Thanks for joining us today. And as I usually go through the numbers, this past week we did not do mitigation testing with commencement going on. We did pre-commencement testing. So mitigation testing, as we have done throughout COVID-19, will restart again on Monday, the 17th of May, when we'll continue the regular testing of our students, faculty, and staff, and that will continue through the summer for those for the university community here in Bloomington and around the state as we turn that back on again post commencement. On the vaccine side, we're very happy to announce that we're up to 31,000 vaccines administered since the 29th of March. 17,400 of those were at that university focused first and second dose period. So we were very happy to get those done as well. And it shows the success of and popularity really of the vaccine since we've been able to kick that off at Simon Scott Assembly Hall. Now, this week, the big news was the addition of 12 through 15-year-olds. And when that happened, we had an overnight uptick of 700 new appointments, which came in. Many of them will be tomorrow, but we still have open slots, 600 open appointments, in fact, for tomorrow at Simon Scott Assembly Hall. So I'd encourage that 12 to 15-year-old group, as well as everyone else, make it a family event if you like. Come on over. We would appreciate it if you'd sign up ahead of time at ourshot.in.gov, but we will have walk-in hours tomorrow. Though the clinic opens at 9, walk-ins will start at 10, and walk-ins will conclude at 2 o'clock. So between 10 and 2, you can just drop by Assembly Hall and get vaccinated. Now, with the next week, we still have plenty of appointments available. Notably for that new group, we've got 320 appointments available just after 3 p.m. on Monday. And next Saturday, of course, plenty more. So that population that would be in school, we've got additional time available there as well. From the CDC new guidance that they put out about masking, at Indiana University, our masking and other protocols will stay in effect just as they are right now. We're going to look at the CDC recommendations and see how that impacts the university community. We're a complex organization with more than just indoor offices. We've got classrooms, we've got laboratories, and facilities throughout the state. So it takes us a while to take a look at the implications of all of these things, but we'll continue to follow the science as we have all the way through the pandemic, and we'll reevaluate with the new CDC regulations and be able to talk more about that probably next week. So with that, I'll stand by for questions.
All right, we will get into the questions. And first of all, I'm going to start with some that were submitted to me by Eric Berman from WIBC, who couldn't be here live, but is going to be checking in on the recording of this. I think the first one was answered. He was asking about the Monroe County mask order and how that would be affected by the CDC revised guidance. But his second question is, how did vaccinations go on Thursday, the first day of 12 to 15-year-old eligibility? How many in that age group? Was there a burst of heavier activity, or are we mainly just seeing the same people 16 plus that we have been? Penny, can you speak to that? And Kirk, I wonder if you might chime in on what it was looking like at Assembly Hall as well.
Well, we certainly saw an increase, but the two vaccination sites at IU Health Med Arts Building and IU, I think that those were both kind of covered in terms of the number of people that were coming in, but we are seeing a strong interest. That's not unusual. Every time a new group has been opened up for eligibility, we do see those individuals who are really excited about getting it, making those appointments very quickly. we think that that will continue. And again, we're working on school clinics, so we anticipate that we will reach hopefully a high percentage of those students, and that bears well for them come fall when they're back in school and they don't have to quarantine if they happen to be exposed, and they don't have to miss classes or a ball game or something like that.
And Kirk, you said there was a little bit more activity that came in with that announcement.
Yeah, there sure was. Now we were not open Thursday and Friday, but we're back open again tomorrow, and we had like I say, a significant uptick, about 700 appointments that came in quickly. That will be spread over tomorrow and next Monday when we're open again. So yeah, lots of good. It's really great to see when we have an uptick like that. It just shows how people are ready to get this and ready to get back to normal life.
Question from Binta Boutier at WFIU. How will mask resolutions be enforced moving forward? Should people bring their vaccination cards with them to prove they do not need a mask at events or indoors in businesses? Penny, you want to speak to that?
Well, if a business or an event, if a venue wants to require a mask, they certainly may, and that is their right to do that. So right now, there isn't necessarily that, we hear a lot of people talk about a vaccination passport, but showing proof that you've been vaccinated will not necessarily mean that you don't have to mask up. If that business is requiring you to do that, then you will need to comply with that business's request or their policy.
Okay. Question again from Binta Boutier for Kirk White. The New York Times has a COVID data dashboard that keeps track of outbreak clusters on campuses. One outbreak category is universities, where IU Bloomington ranks number 2 behind the University of Florida. Why is it that IU has recorded more cases than other universities on the list? And she notes that Ohio State is number 3, the University of Wisconsin-Madison number 4.
Well, that's a good question. I haven't seen that report, but I'll say this. We've also been recognized for being one of the most comprehensive testing universities in the country. And when you have more testing facilities in place, and when you're testing people twice a week, as we did in our communal living facilities throughout the year, you know where the cases are, and you're likely to have higher numbers. This was debated at the national level last year about the more testing you have, the more positive cases you have. We think that was a good policy. So we've been very transparent by having the increased testing. We would have higher numbers just in logical terms. And the other thing I'd have to look at on that report was whether they were looking at just a Bloomington campus or whether they were looking at all of our campuses around the state. Sometimes those two get confused when they roll up all the numbers for Indiana University at all of our campuses.
Yeah, and I will speak to that part a little bit. They do have each campus broken down there, but I will say this, and Dave Askins, who's on this call, actually noted that this to me, that at one point they had all of the IU numbers for all of the campuses as IU Bloomington numbers, which of course made us far and away number 1 for campus numbers in the country. So it's been that's the New York Times. I will say they have been working. They have contacted us many times to ensure that their numbers are what are reflected on our dashboard. But it does mostly reflect that we just have a large campus in Bloomington, and we've been doing a lot more testing than pretty much anybody else in the country, as Kirk said. Next question coming from Dave Askins at the B Square Beacon. Monroe County's positive case numbers are trending down, but we've also seen a mass exodus of a significant part of our population. For local decision making, shouldn't we compute a kind of custom summer version of the cases per 100,000 metric that accounts for missing college students? Penny, you want to speak to that?
Sure. I think this is a good example of why we will tell you that no one metric is what you use, that you look at the full picture and you gather a variety of information. So we know that with less testing that our positivity rate may tick up a little bit because we have if we have still maybe a smaller number of people testing positive, but the pool is also smaller, that the positivity rate may go up a little bit. But the cases per 100,000 should actually keep that pretty consistent, because that measure is how you can compare a large community to a small community. So you're not just looking at raw numbers, but you're looking at cases per 100,000 or per 10,000. 100,000 is used most often, but it gives you a greater ability to compare one to the other. But we will, Dave, have to continue to look at those numbers. And one thing that I failed to mention when I gave my summary is that the Board of Health is still scheduled to meet on May 19th, which is Wednesday. So for any of you who have heard me accidentally say Tuesday, because I'm used to them meeting on Tuesdays, they are meeting Wednesday at 4:30. They will still do that. And they will continue to meet regularly so that they can assess data and what's going on in our community, because we can always revisit specific strategies to deal with any kinds of circumstances or increases that we have. And so they will look at information to guide the policies that we use as a community in our response to this. But again, at this point, it makes more sense to deal with those things as they may come, more individualized as opposed to a large mandate across the county.
Penny, at this point, I wonder if we could go back to what you said at the beginning regarding what is going to happen in the county with the mask mandate. But I had a few people asking for that to be repeated and
Okay.
make sure that we understand.
Certainly. So the health officer has the ability to rescind our health regulation, our health order, which is in place. Right now, has an end date of May 28th on it. He is rescinding it as of Monday, May 17th at 8 a.m. So that will no longer be in effect. We essentially will be following the governor's executive order. The Board of Health will still meet on May 19th. They will assess. I would expect that they may come out with an advisory statement of some sort in terms of what the recommendations are and making some clarity around that. But certainly come Monday, our local regulations will be rescinded.
So can you elaborate on what that means for gathering sizes in the restaurants and bars?
So gathering sizes right now in the county are at 50. That will no longer, there will not be one. There won't be a limit. Restaurants and bars, so right now they have an early close time, no bar top seating. Those things will go away and they will not be a requirement. Now, we would recommend, that they consider keeping all of those things that are in place that have gotten us here. They make sense to continue. So even in the governor's executive order, parties at tables should still be 6 feet apart. While that may not be part of the regulation, it is still certainly a recommendation, and it is part of what got us to today. And so we would encourage people to keep those things going.
And to be clear, it can be something that the business, the bar, the restaurant can keep those things in place. They can have a sign and say that, and that's what they want to do.
Absolutely. And we started, if you remember, kind of back last year, we started out, there was recommendations. And so businesses could require them. Some did, some didn't. And when we put in the regulation, then it was required in all of those. So absolutely, a business who wants to continue to require masks may do so. And we will all be obliged to follow that requirement if we want to be in that business.
Okay. We have a few minutes left. I'll wait here a moment to see if there are any other questions. Just a quick reminder that those vaccines for ages 12 and up now are available going to rshot.in.gov. I know from personal experience of looking for someone in my household that fits in that age range that you can get some appointments at Assembly Hall, but also at places like CVS and Kroger. Those are very much open, and those are available for Indiana University as we start to begin towards the summer session here, and then building towards the fall. Our decision making on all of those policies will be at covid.iu.edu. Next question here from Dave Askins. This is for Mayor Hamilton. The Bloomington city limit of gathering sizes of 15 is still in place for now. Is that correct?
That is correct. Legally, we are going to be looking at it. It's a quick change, but I know the county you've announced the plan to drop the 50 in the state. What the state limit, if you can remind me, if there is any, maybe there isn't any limit.
There is not.
Yeah. So, we will be looking at it. Let me just say that. I mean, I will say, there's still a concern about large numbers of unvaccinated people gathering and causing issues, but we'll be looking at that very quickly.
Okay. All right. So we are coming up on 2:00, not seeing other questions at this moment. So we will leave it there. We will be back again next Friday at 1:15 to talk about COVID-19 in the city, the county, Indiana University, and Indiana University Health. Until then, have a good afternoon.
Thank you.
Thanks a lot, everybody. Take care.